Hello, everybody. Welcome back to the Harmony Inspired Health podcast. Today, we are going to be talking about a question that I get asked all the time from so many different people who are really super curious about what it is that I actually do as an Ayurvedic practitioner and what can we do once we become an Ayurvedic practitioner. Like, what is it? Like, what exactly is it? And today, I'm actually very honored to have a beautiful friend of mine and colleague who is also an Ayurvedic practitioner to come and share her story. Because although we're both qualified in the same field, we do slightly different things. And I don't think people realize how many different pathways you can take with Ayurveda. So I thought, yeah, Helena, come along and share with the audience all about your journey, because a lot of them know a bit about my journey, but I want to sort of get into someone else's journey with this as well. And the other beautiful thing about Helena is, as I mentioned, she's an Ayurvedic practitioner. She works in the clinic with me as well. And she's also one of our faculty members of the Ayurveda Alchemist Academy and has a huge background in Ayurveda. But also you started off as a teacher, didn't you, in PE or something? Yeah, share your story, where you started and why you decided to study Ayurveda.
So yes, thanks for having me, Harmony. I'm very happy to be with you and sharing a bit of my story, especially because I can feel that nowadays I'm following my Dharma. I'm really very into what I really love to do with my heart. So it's very nice to have this moment to share this with you all. So I think my professional history started with my degree in physical education. Physical education in Brazil, where I come from, is a bit different from here because there is a huge university where you study at least 5 years full time to get the certification for a physical educator. And with that certificate, you can work both with personal fitness or at the schools. Since the first years of the school from prep, we are there offering everything that the body, the physical body, the movement, the dance, everything that is related to movement and body, we try to teach them there. So it's a kind of different profession in Brazil. And after completing this graduation, I post-graduated in exercise physiology, and that includes also nutrition and biochemistry. Was a very deep in study everything related to training for athletes. So yeah, I like that, but I couldn't feel that was my pathway. And then after starting working with physical education in a big company in Brazil, I decided to do the 2-year Pilates instructor training. That was nicer. Oh my God, now I can talk about the body. Now I can talk about the spine and the movements and how the muscles work. But I wasn't satisfied, so I jumped in the 2 years yoga teacher training. And that was amazing because then I could start teaching about the energetic body, the chakras, and more that which goes beyond the physical body. So I was very happy with that. But when the pandemic came, I started rethinking about what I was working with. A lot of yoga classes, but also gym, sports. And that was when I decided started studying Ayurveda. And actually my first course was back in 2007, but it was an intensive course, a wonderful experience in the south of Brazil, though a bit superficial as all intensive courses. And just during the pandemic, I started the full certification in Ayurvedic Practitioner. And then I specialized in Kaya Chikitsa, a different name, but we know this means the clinical Ayurveda and the study of each of the main diseases according to Ayurveda. And now I'm diving deeper into a 1.5 year focused on the women's and children's health.
Oh, I love how you've got such a, like, huge background, like, vast background in how the human body actually functions, like, from a scientific perspective as well as an energetic perspective and an Ayurvedic perspective, obviously, as well. And I think that is really beautiful in our day and age because you can kind of speak to people on their level in the modern world. You know what I'm saying? As in, like,
Mhm.
because you have that clinical background, and that's what sort of in the West we're mostly brought up with. You can translate what that can mean from an Ayurvedic perspective, which is a really beautiful skill to have, I think, as a practitioner, but not necessary for everyone that goes down this pathway. Some people have just gone straight into Ayurveda and all the way, which is beautiful as well. And so as you know, I too came from more of a clinical background as a registered nurse and worked in emergency departments and theaters, like surgery, all of that. And then also went down like personal training and yoga and Pilates. I think when you're really passionate about health and wellness, you just never stop learning and studying and you do all the different modalities. And then it's like when you find Ayurveda, and I think this is the same for you, we've spoken about this, it's just like, oh my God, like this is it. This is the anchor that brings it all together. It bridges all the gaps between all of these different modalities and brings it together because Ayurveda is the science of life. That's what we're dealing with. It's like this holistic, beautiful, broad spectrum of a health science that encompasses pathology and disease management, but also psychology and philosophy, which a lot of the other health modalities in the West don't offer. I love that. Now, we have been asked multiple times, what exactly is it that we do? Like, is Ayurveda a woo-woo science? What would you say to that?
We have several pathways to work with Ayurveda, and I can say that this is so real that if I share with you now everything different that I'm doing just right now, and it's everything related to Ayurveda, you will see a little bit of which pathways you can follow when you study Ayurveda. Because from preparing meals, you know what I mean? Like doing the catering for retreats and helping with diet. But not only that, you can work with massages if you like. You can work with consultations that only gives the orientation for lifestyle and diet and general guidance, not going deeper into the diseases. You don't need to do that. But even doing this general orientations according to what you learn with Ayurveda, you can
Mhm.
transform lives. You can transform lives. And sometimes we think that we need to go too deep in the knowledge of the Ayurvedic medications and the knowledge of everything related to the physiology and anatomy. But when you learn the basics and you try to apply the basics in your life, in your family's life, and in your clients, you see big changes. So
Absolutely.
that's what make me happy.
Absolutely. Ayurvedic really is an embodied science and an embodied wisdom. We always, like, even in our academy, we teach the women in there to embody it first before they go and share with others because you live and you need to feel it and individualize it. Like Ayurveda is a very individualized medicine. That's why we go off the everyone's different constitutions and what's going to work for you might not work for me. So it is so important to understand yourself on that deeper level and that's what it really helps you do. So for my like the way that I work with Ayurveda, which brings me to another point. I love how you can like merge it with like basically any modality because it's again the science of life, so it's so complementary to everything. Um, but I have merged my nursing, my Western medical background, and my TCM. So I'm a doctor of Chinese medicine, acupuncture as well, and I've merged those with Ayurveda. And for me, Ayurveda is my core, and Ayurveda is the foundation of what I do. But I bring in these other aspects to serve my community and my clients and my dharma and passion. And I think that is so important. Like we often specialize in different areas in Ayurveda, and I love doing that. I love specializing in the area because I want to be like really good at what I do. So I know what, I'm offering is beautiful. But you can be quite broad with Ayurveda and treat anything. So the way I use it is I'm a women's health professional. So I specifically help women support their hormones. And with that comes the side effects of stress and anxiety and all of that. But then I've also, as you know, co-founded a school, the Ayurveda Alchemist Academy, where I'm teaching Ayurveda to other people so that they can go and serve their community through being an Ayurvedic consultant or an Ayurvedic practitioner. And I also run workshops and Vedic breathwork classes. And with you, Helena, we run the Vedic Bodywork certification and run retreats. And there's so much magic in what you can do. And that's what I specifically like doing. I did used to do the Ayurvedic body therapy like Abhyangas, but I actually don't do that anymore because I went more of a clinical consultant role through my pathway. But for you, Helena, you do a lot of the body works and you do a lot of the nutrition, a lot of like physical meal delivery to people or cooking Ayurvedic meals. So how are you using your Ayurvedic practitioner lens differently to how I am?
Yeah, I love the example you gave about the Chinese medicine, or even when compared the Western science treatments. And it's very important for us to remember Ayurveda is not an alternative science, an alternative therapy. It's complementary. So Ayurveda can always, always, always work with the other therapies, independent in which therapy. It is the Western therapy, it is acupuncture, everything matches with Ayurveda. So this is the first thing. It's not because we are talking about a weird word, Ayurveda, what is that? No, it's the science of life, it's the oldest medical science, the oldest medical system of the humanity. So why not try that? So answer your question now. Yes, I'm working at the clinic with you with massages and body work therapies at the Women's Health Clinic, which is becoming such a beautiful space, Harmony, with regular clients who are increasingly curious about Ayurveda. And I really love this kind of clients that are there. Oh, what if I try that? What if I try that? Is there a consultation? So I'm just loving this experience with the body therapist, because we know it's not a moment for you to relax, it's a treatment. So when the clients start realizing that that is much more than a time for relaxation, they started getting curious about Ayurveda. So
Can I just ask you, like, what is the point of these body therapies that you do? And can you explain some of them that you do, like what you're exactly doing? Because they are a medicine in their own right. Like you said, they're a treatment, not like a, relaxing time. It's like an actual medicine. So can you explain why and what they are?
yeah, so yeah, maybe talking about how I work there. So the first step is always ask the clients to fill in a form. In this form, they will tell a little bit about them, their occupation, their age, their name, and everything related to their health. Using that form, and this should be very quick because they don't want to lose time only chatting. But I try to figure out which dosha, the energies that govern our body and mind, which doshas are predominant in that person. If there is any imbalance, if there is any digestive issue that I must take care. So I try to just catch some important informations for what? Choose the right oil, choose the right herb, and choose the right treatment for this person. So sometimes it happens the client book for an abhyanga because it's the most traditional massage, that is the oil, the full body oil massage, but there they kind of change the treatment, or at least try to begin to think about another treatment that will suit better for for her or for his. So that's how it works. And then we jump into the massage table, and usually after the treatment itself, you go straight to the sauna, the infrared sauna, which works improving the the penetration of the properties of herbs and oils into the skin and other tissues. Yeah, so that's how the treatment is. Of course, it depends a little bit on the treatment.
What about Shirodara and Udvatana? Can you just speak on those two
Yeah.
treatments? Just to show that there's really different treatments. I don't think people understand that. I think they think you come in and you get like some sort of Ayurvedic massage or an Indian head massage or something like that. So yeah, why would you have a Shirodara treatment and what is it? And Udvatana treatment?
Yeah, so Shirodara is the most relaxing treatment in Ayurveda. So it's used mainly for those who are very, very stressed, very, very anxious, or with any issue predominant in the mind, in the emotional aspect, in the psychologist, psychologist aspect. So burnout, anxiety, stress, insomnia, and even some physical things, for example, psoriasis or draft in the scalp. We can also work with Shirodara. That means the oil is the pouring of oil, is the streaming of oil in the center of the head that keeps here. Of course, the client is laying down and it keeps here only with that oil being put it here for 30 to 40 minutes.
Yeah. So
The
continuous
oil
warm oil on the forehead.
forehead, of course, we start with massage, massaging the face, massaging the scalp, massaging the neck, and then the oil protecting the eyes. Um, and after that, again, massage to work with the marmas that are in the head. And the oil also changes depending on the situation. And we can also use milk or buttermilk in this treatment, but in specific cases. Yeah. And Udvartana is nothing more than dry massage. It's massage made with herbal powder and only a small amount of oil. So it's kind of exfoliation with very, very intensive maneuvers to improve circulation of fat tissue, improve circulation of blood and lymph, and help the treatment of obesity or any program of weight loss, and also every imbalance that shows some blockage of channels.
And when you spoke of mama points, just for our listeners, like the mama points are the Ayurvedic equivalent to our TCM acupuncture points or acupressure points.
Yes, yes. There's points that are similar, and I think there are others that are a bit different, but we can work with both at the same time.
Yeah.
Even with the cupping that we are going to learn in the bodywork therapy, we have the cupping in Ayurveda as well. So it's very complementary.
Yeah, absolutely. And so you do the Ayurvedic consultations, as we spoke of, the Ayurvedic bodyworks, and then another pathway that you've taken with Ayurveda is really like you love cooking and you're fantastic at it. Like I love your meals, and you love bringing in all of the Ayurvedic wisdom and love and everything into the meals that you do make. So can you explain, as an Ayurvedic practitioner, what this pathway could look like for somebody?
Yes, of course. First thing I have to say is Ayurvedic food is not a specific cooking, it's not a specific culinary, it's every food. The food that we have here in the Gold Coast that is seasonal, that you are used to eat, of course, as much healthy or as much fresh as better. But that's the Ayurvedic food. The much fresh is better. The way you prepare your food, the attitude when you are sit to eat, being grateful for the food, chewing well in a nice atmosphere without discussion. And of course, we learn in our course that we have the six tastes. We try to combine the six tastes of salty, sweet, sour, astringent, bitter, and pungent. So we try to bring these 6 days to the meal, but the meal is a normal meal. It's nothing very hard to learn how to eat. And we also use the spices, the combinations of spices that we usually call masalas. We can try it with this little step in the Ayurvedic diet, just sprinkling some of these spices in the things you are used to eat. And this is a big start. You start bringing more spices, and that would mean giving some power for your digestion, giving some fuel for your fire that we call Agni. That means the digestive fire. And when we digest food better, we digest life better. So that would be the first step.
Beautiful. And you've used your passion with Ayurvedic nutrition to teach Ayurvedic cooking classes and to create a meal service for yourself that you deliver to people local to the Gold Coast. Is there anything else that you have done as an Ayurvedic practitioner on your journey, on your pathway through
Yeah.
the business journey? Yeah.
Yes. A part of the preparations of the meals, I'm doing the catering for retreats. So this was a very funny story in an unexpected way. So Jean, that is a very experienced yoga teacher from this region, was looking for a chef. And she runs a lot of retreats, even in Bali. And she posted about it on Facebook, and I was there. I'm looking for a chef for my retreat. And I saw it and thought, well, I'm not a chef. I'm not a chef, but I do make delicious Ayurvedic food.
Yeah.
So that was another beautiful Ayurvedic path. And that's already opening new doors. We are planning to bring more Ayurveda into that yoga retreats. So it's a very nice pathway. And what else, Harmony? The workshops. We had the cooking workshop. There are people already asking when the next one will be. And I'm trying, actually, I have one next workshop that will be all about the doshas, to unlock your dosha, and it's ready to go. I love to teach and to work with teaching. And yes, there is the business consulting as well. I work for companies to
Mm-hmm.
improve the health and well-being for the company employees through consultations, but even behind the scenes. So this is a story that I really love, because when I first came to Australia as a student, studying at a not so great school in Southport, so one day, a classmate reached out to me because she was going through a very difficult time with anxiety, digestive problems, and I did a consultation with her. And when she asked how much it costs, and I said, nothing, we are classmates. Aren't we classmates? I mean, we are both students, we are learning together. And a few days later, she was feeling much better with the treatment, and she called me and hired me to work as an Ayurvedic practitioner in one of her companies, which supports people with disabilities. So it was very interesting, this story, because today I work not only with her clients, I mean the ones with disabilities, but also with the employees. And now we are expanding to another business that she has few companies. So it will be a great challenge, Harmony, because it's a logistics company,
Wow.
with many truck drivers who
Wow.
live in ways quite opposite to Ayurvedic.
I love that though. Like you go corporate, but in the most, yeah, these sort of what do you call, like, businesses that probably haven't even heard of Ayurveda. So this is great.
Yeah, so that's a very interesting pathway, but it's growing, I can say.
Yeah,
Yeah, but
that's
what I
amazing.
love the most, even though my English is not perfect yet, is teaching Ayurveda for the Ayurveda Alchemist Academy and being part of this inspiring community. It's such a joy to share my knowledge, learn from our amazing teachers, and grow alongside our wonderful students. They are the best. I love them.
It is. We're so lucky. We do have the most beautiful students and alumni because once you're in the community, you never leave. You're there
No,
forever with us, which is so beautiful as well.
we have students that even came back to their countries and they are still part of the communities, attending to the classes. So they are the best.
Yeah, absolutely. Well, thank you so much. I think you've painted a really beautiful broad picture and again, doing different things to what I'm doing in my business and who I'm serving. Like you're about to serve truckies and I'm serving women like completely different.
I still don't know how I'm working to do it, how I'm working with them, but I have to think.
Well, actually, one of our alumni from the academy, she is all into men's health, like that's her passion. But she's now working with just like footballers, as in soccer players, like really high-end professional soccer players, which is amazing. So I love that Ayurveda is getting out there, and there's just so many pathways for it from just consulting online, in person. You've got the Bodyworks, you've got the retreats, you've got the catering, you've got the meal prep and cooking classes, and you've got the corporate pathway that you can go down, and courses and workshops, and probably so many other pathways that I haven't even really thought of. I mean, we haven't even talked about panchakarma, and I think that could probably be a whole new episode, but the deep cleansing and detoxification, purification method that Ayurveda is so well known for. I mean, there's so many beautiful panchakarma centers in Bali and India. I don't know of a really good one here on the Gold Coast that you can actually stay at, or even in Australia where you can actually physically stay at. There's a lot of places, including like even our clinic, we can offer panchakarma, but as an outpatient. So I think there's so much more opportunities still to experiment with and explore in Ayurveda. So people listening are probably thinking, well, how do I become an Ayurvedic practitioner? And the first step is you do have to do your level 1. So you have to do the Ayurvedic Health Consultant certification, and that's across the world. Like that's how you can step into it. And sometimes it's called Ayurveda Health Counselor. So they're the same thing. And then you can go into a level 2, which is a specific clinical Ayurvedic practitioner training. So Helena, what is the difference between an Ayurvedic health counselor or consultant versus an Ayurvedic practitioner?
Harmony, if I think the main difference is kind of the herbs you can use, you are allowed to use when you are a practitioner change. So the list of herbs you can work with, you can suggest for your client changes a lot when you turn a practitioner. And also, if you really want to be a practitioner, you need to go deeper into the study of the anatomy, physiology in a deeper way. We learn all of that in the level 1, but you must go deeper. And when I say that, it means also the Western view of the human body. So as much as you go and study the anatomy and physiology in the Western view, deep in the studies of that, in the books of that, in the medical science, and also the disease. So we will go very deeply in each of the disease, diabetes, arthritis, obesity, and so on, heart diseases, skin diseases. So we're going to learn all of that. And that's one of my passions too, because unfortunately, most of the clients already come with some diagnosis. And it's very interesting when you know that name, you know what I mean? You will always have the chance to research about that, but if you already know what they are talking about and you know what is the Ayurvedic view about that disease process, you will have the tools to bring that doshas, that energies back in a totally natural way, in a totally out of any side effects or comparing with the side effects we see in the allopathies, in the medical medications. So we will find a way that will deal with diet, lifestyle, bodywork therapies, and also medications, not only medications.
Yeah, absolutely. And how you can work alongside like allopathic Western medical doctors as well as a complementary
Yeah.
therapy and treatment. So understanding, like you said, the disease pathology from a Western point of view, as well as medications that they're on and stuff. And, because herbs can be contraindicated with different medications, and you've got to know that, and you've got to, yeah, understand all of this on a deeper level. You're a practitioner of this art and science. That's yeah, it's done in stepping stones, and level 1 is the first entry point. The good thing though about it is you can start working straight away as an Ayurvedic consultant whilst you're starting to be a practitioner. So you're still working in the field and you're still doing the basis of what Ayurvedic practitioners do, which is um, dietary and lifestyle and different therapies dependent on that individual's constitution, whilst you're studying deeper into the science of Ayurveda to become that practitioner level. So it is amazing. And yeah, I think we didn't even talk about like going down the Jyotish astrology pathway in Ayurveda. There's just so many, but I won't open up
Yeah.
anymore. I think we've let people know that what they've sort of been asking what
But
to do, and we do.
I know practitioners that made the graduation with me that are working only with Marmas and Jyotish. They
Yeah,
chose that. They just chose that pathway. So they are working only with subtle therapies. And we learn in Ayurveda that the subtle therapies are very, very important, especially when it comes to mental issues. So
yeah,
this is a very important branch of Ayurveda, talking
absolutely.
about emotions, talking about the mind, and how these subtle treatments that mean Jyotish, but also mantras, aromatherapy, chromotherapy, and all these subtle things into the people's life and health. Yeah, it
Yeah,
changes everything.
absolutely. And I think people are also surprised to know that there are 8 different branches of Ayurveda. Like there are the 8 branches of Ayurveda when we're looking at Kaya Chikitsa. So we've got like the internal medicine, there's the geriatric and longevity, pediatric, women's health, there's surgery, which people are quite surprised by. ENT, ear, nose, and throat, toxicology,
Gyne-
there's
Gynecology,
gynecology, there's psychology.
clinical, yeah,
Yeah, I don't know what I've missed. I think I've missed a couple. But the aphrodisiac, like psychology, yeah, Rasayana, yeah, absolutely. So there are different parts of Ayurveda that does make it so whole and yeah, really beautiful. And a lot of people choose to specialize in one of those pathways, and a lot of people take it on as a really holistic science, and we'll see anyone who comes through the door. Thank you so much, Helena. It's been a pleasure talking with you. It always is. We always have amazing Ayurvedic conversations, which is so nice to have people in your community that you really talk to. I know when I first sort of delved into Ayurveda and started offering my services, I was like one of the only ones on the Gold Coast, and I really didn't have a community. So I've loved being able to build that with the students and the other Ayurvedic practitioners that are now here. And yeah, thank you so much for being such a valuable part of it.
My pleasure, Harmony. Is very, very nice to see that community growing. And you are responsible for that because all your effort in promoting Ayurveda, in offering that amazing courses each day, they are more complete. And I love to see the authentic Ayurveda mixed with the modern view of the health and life. So thanks for bringing Ayurveda in such a authentic way, and I'm very happy to see this community growing.
Thank you. And thank you to all of our listeners. If you are interested in studying Ayurveda, check out the Ayurveda Alchemist Academy. So ayurvedaalchemist.com.au. You can find all of our courses there, including our level 1 health consultant course, level 2 Ayurvedic practitioner, which is kicking off in 2026, which is very exciting. We've also got Vedic breathwork, and we also have the ISL bodywork therapies that we had discussed. So lots of different pathways for you to choose throughout the academy as well. Thank you so much. Namaste.
Stay.